I wanted to start off by telling a story from one of my clinicals. It was middle of the day, and I was doing my practicum on the Radu. My preceptor got called over to the emergency because it was so busy, and so I followed. It was chaotic. People were in stretchers everywhere. The waiting room seemed full, and you could tell the staff were moving around as efficiently as they could. Our job was to help out with tasks such as taking vitals, hanging fluids, and other such things. After being on the unit for about an hour, a nurse in passing asked me to stop in on a patient and take out her IV. She was ready to go home once the doctor left the room. The doctor had left the room, so I walked over and went through the door. When I slid the door open, I saw a middle-aged woman sitting on the bed. She looked up at me and I smiled and said hello. She said hello back. I let her know I was going to take out her IV and then she would go home. She said something like, okay, and put out her arm. I washed my hands, put on gloves, grabbed a piece of gauze, and a small piece of tape. I let her know that it might sting a little. She flinched, as most patients do, as I pulled horizontally on the tegaderm to lift it gently off her skin. The room went silent, and I was aware of the chaotic sounds behind the opaque doors shutting us off from the rest of the unit. Casually, I said, "What brought you in today?" Now this is a question I ask every patient, regardless of whether I have looked in their chart or not. It allows me to see their perspectives on why they are here, which is so very important. Because of the current circumstances, I had not looked at this woman's chart. So, what brought you in today? And that was when she let me know that she had just been diagnosed with pancreatic cancer. She had no idea what was going on when she came in with some abdominal pain. Now she had cancer, which was likely terminal. Her tears fell softly down her cheeks as I swiftly removed the IV and made sure the tubing was intact, threw it in the garbage, and then held the gauze on her arm. I made a conscious decision to hold the gauze a little longer than normal. She cried, and we spoke about her family and supports, and how this was going to change her life. It was a short conversation, maybe 2 minutes. My hand on her arm the entire time. She left with a plan to go to the cancer agency in Victoria, and then spend some quality time with her family and friends. Now this moment will stick with me for my entire life. This is nursing. Everything in nursing school bubbled into that single moment when she told me about her diagnosis. We learn about theories, assessments, anatomy and physiology, technical skills, relational practice, caring, community resources, teaching, and research. But nursing is even more than that. It's authentic. It's that unexplainable connection between human beings, often strangers. It's those moments of clarity when the only thing that matters is the person right in front of you. That moment when the nurse gently holds the little boy's hand as he goes to sleep before an operation. That moment when the nurse carefully spoon feeds the man who just had a stroke. That moment when the nurse thoughtfully hands clean supplies to the woman at the needle exchange. That moment when the nurse says congratulations after your wife has given birth to a baby girl. This is nursing.